Hi everyone, I want to welcome you all to our 2020 virtual orientation. I want to start off by congratulating you all for being accepted into our pharmacy studies program here at UConn. To introduce myself, my name is Robert Koschel. I'm a PharmD candidate, class of 2022 here at UConn. And within our school, I'm a Leaders Track Scholar, co-chair for the Pharmacy Ambassadors Program, and president-elect for Kappa Psi, which is one of the pharmaceutical fraternities that we have here available. Why I chose UConn was because during my visit, I noticed how tight knit the students were together, and I saw the great interactions that they were all having together, and it will create a very good learning environment, as well as I could tell by talking to the professors that they truly cared about students learning. And even though sometimes it doesn't seem like that, there could be a tricky exam question and it seems like they're out to get you, they really aren't, and they really care about your learning, and they want everyone in our program to be successful pharmacists one day. Also on this chat today are Daniela, Aaron, Bella, and Kat, who are also pharmacy school ambassadors. If you have any questions throughout the PowerPoint, you can use the chat function and send them your question or comment, and they'll be more than happy to answer it. So here's some information about Daniela and Aaron. And here's some information about Kat and Bella. Again, don't hesitate to ask if you have any questions for them. So during the presentation today, I'm going to talk about opportunities that UConn gives student pharmacists, as well as opportunities you'll have in the workforce having graduated with a pharmacy degree. So some points we're going to bring up are why become a pharmacist, career tracks, pharmacy school, and specifically UConn School of Pharmacy. So why pharmacy matters. We have an aging population, which means more medications, which means there is the potential for more drug interactions. Pharmacists are a critical part of the healthcare team. They have knowledge about drugs that others don't receive. So pharmacists are in interprofessional healthcare teams with doctors, nurses, physicians, assistants, and other healthcare providers. They don't have as extensive schooling and education on medications that we receive. We receive 4 full years of schooling just on medications. Some other healthcare profession schooling could only have 1 year at most on medications. So we are the experts, and doctors and nurses will turn to us to answer medication questions. And pharmacists improve patient outcomes, whether it be catching the potential drug-to-drug interactions, or even some UConn School of Pharmacy professors are working right now with COVID-19 and helping care for patients, helping prevent the virus in patients, and also working to create vaccines. So why become a pharmacist? So this personal satisfaction in helping others, that goes along with the last slide's bullet point about improving patient outcomes. You can help improve someone's health, which will in the end help extend their life, and that can be very gratifying and rewarding. Lots of diverse career paths open to pharmacists. There isn't just community and hospital. We'll go into multiple, but there are a lot of different career paths that pharmacists can go into. High starting salaries. Some pharmacists come out with a PharmD degree and start making $100,000. If you go to college to come out to have a well-paying job in pharmacy, and becoming a pharmacist is one of those ways to do it. And you have a love for science in the healthcare field. You can already have this in high school. You probably have shown this already by taking and enjoying your chemistries, your biologies, your anatomies, and your other core science-based classes. Year in and year out, pharmacists are one of the most trusted professions on the market. As you can see by this up-to-date chart that was done in 2019, pharmacists ranked number 4 as one of the most trusted professionals, just behind medical doctors, engineers, and nurses. And this statistic in this chart fluctuates year to year between engineers, medical doctors, and pharmacists. So pharmacists are from the top 4 to sometimes the top 2 most trusted professions out there in the workforce. So now we're going to go into some potential career options. We have community pharmacy, hospital pharmacy, industry, working for a pharmaceutical company, academia, teaching and doing research, government organizations, which are working for the FDA or CDC, and specialty fields. This is working for geriatrics, pediatrics, oncology, psychiatry, and there are other career options. Other than this, there are many, many, many different branches of pharmacy that I aren't even aware of yet, but these are the major ones that most people go into. So let's dive in a little bit to the community pharmacy. As a pharmacist working at CVS or Walgreens, you'll be dispensing medications, counseling patients to make sure that they are taking their medications safely, effectively, and as instructed. In our communications class that we take during our pharmacy school education, we really want 100% patient adherence. And we learned that patient adherence is that patients must take their medications as instructed by their doctor, not how they think that they should take them. Also, community pharmacists work on educating patients and administering vaccinations. So at your CVS or Walgreens sites, you will be administering vaccinations, flu vaccinations, Hep B vaccinations, tetanus vaccinations. Hopefully, if we come out with a COVID-19 vaccination, that will also be administered at CVS and Walgreens as well. And educating patients. Pharmacists are the most accessible healthcare provider in the health field. You can go to your CVS and Walgreens and not even be a patient there and go up and ask any health questions that you have, and the pharmacist there will try their best to answer it for you. And that's, if you work as a pharmacist there, that is what's going to happen. You can also go into hospital pharmacy, where you're being a part of an interdisciplinary healthcare team and working with physicians, nurses, and other healthcare professionals offering direct patient care contact. So while doing this, you'll be verifying medications that doctor orders, making sure there's no drug-to-drug interactions, making sure the medications are appropriate. You'll also be distributing medications and counseling patients on these medications as well, telling the patients what the side effects might be while they're there, because they could be very nervous and they're in a very stressful situation by being in a hospital in the first place. You'll also work with many doctors, nurses, physician's assistants, and other healthcare providers. Academia is another branch you can go into. This is educating and advising future pharmacists, such as what my professors and my administration does for me now. Working with students while engaging in clinical research and or in clinical practice. Speaking at industry events, contributing to science and education publications. So something that's very unique about UConn that I really enjoy is that all the professors must still be practicing. So if you go into the pharmacology aspect and you teach classes involved in pharmacology, you must still be doing research if you want to teach at UConn. Or if you want to teach the clinical aspect of medications in, say, psychiatry, then you must still be practicing at clinical site, for example, in a hospital. So it keeps the professors very up to date with what is happening in the healthcare field. And I think that really translates to the way that they teach our students and keep us very up to date and very informed. So now we'll go into specialties. There's geriatrics, pediatrics, and oncology. This is just 3 to name a few. There's also endocrinology, psychiatry, as I named before, neurology, dermatology. There's many, many others. So geriatrics is providing patient care to the elderly population. As I said before, the population is aging and getting older. More medications are being used. So this patient population needs to be watched, and we need pharmacists for that. Long-term care in nursing homes and assisted living facilities is the place where you'll be most found, because that is where your patient population will be. Pediatrics is another one, providing patient care to children up to 18 years old. Safe, effective, age-appropriate dosing. The standard dosage that a normal tablet or capsule comes in of a certain medication isn't going to be safe for an infant. You're going to have to dose adjust. You're going to have to compound medications that will be appropriate for this infant. And you're going to have to be the pharmacist to calculate how much of a drug should be given to a patient that is 2 months old that only weighs a certain amount. There's also oncology, providing care to patients with cancer. Medication management is a huge one here. So you have to manage the medications that don't involve cancer treatment, and then also manage the medications that do involve cancer treatment. So it's very involved. So why UConn Pharmacy? We're going through our curriculum a little bit and what sets us aside from other schools, and also what we have available to our students to help in the learning process and help them absorb the most information that they can to be successful pharmacists. So we have laboratory learning. As you can see in this picture, we have a mock sterile compounding room. They have hoods, they have the demarcations for the buffer rooms. So in this class, you'll make sterile compound preparations, such as IV bags in hospitals. We also have non-sterile compounding, which is these are 2 required classes. And in non-sterile compounding, you'll be making gels, ointments, creams, capsules, tablets, and lozenges in lab. And there's also advanced compounding that's open as an elective. And this sets UConn apart from other schools because we have 2 required lab courses, when most other pharmacy schools don't even have 1 required lab course. They sometimes don't even offer them as electives. We also have our traditional lecture learning, which you'll be taking your heavy pharmacy courses in. You'll have your module courses, which are dermatology, psychiatry, neurology, endocrinology, nephrology, learning about all the different body systems, immunology, to name a few. And you'll be taking notes, taking exams in those. We also have patient care learning, where we train pharmacists to learn how to take blood pressures, be CPR certified, learn how to give immunizations. During your 3rd year of schooling or your P1, first year in the professional program, you will be immunization certified, which means you can go out and give vaccinations. You can work at the student union at a flu clinic and give vaccinations to the students. I think it's very helpful in our learning, and it prepares us to go out into the workforce and really handle these problems. Community service learning. So this is a part of our curriculum as well. Our curriculum requires us to go out into the community and work with underserved populations or work with other members of the community to help them. We take the knowledge that we learn in the classrooms and in the practice labs, like taking blood pressures, and we go out into the community and we show off what we know. So right in this picture, it's interdisciplinary, like I was talking about before. It looks like it's a nursing student and a pharmacy student working with this mother and her baby. The nursing student might be going over some anatomy and physiology about some characteristics of the baby, and the pharmacist might be going over medications that the baby might be on that the mother should watch for certain side effects or adverse reactions, or also how to keep the mother healthy as well. And so we have these service learning projects where we can do things like this. We can volunteer at a flu clinic, whether it be at UConn or somewhere else. We go into migrant farm worker clinics. We'll do brown bag events where the migrant farm workers that work at the farms will bring up a bag full of their medications, and pharmacy students will go through them and tell them what each medication is for, how it should be taken, and when it should be taken. You can also do a poster and present in the student union at UConn about what vaccinations you should receive before studying abroad. There's many different things that you can do to fulfill this service learning requirement, but as long as you're going out into the community and helping people, that's what UConn School of Pharmacy wants you to do. They want you to be a well-rounded individual. They want you to go out into the community, and they want you to be willing to help. And that's what we do. We also have study abroad programs. This is a picture of some pharmacy students in Beijing, China. The class that they took was traditional Chinese medicine, how it used to be back in the day, how the first medicine came from China, and some of the techniques that they used and what we took from them that is still useful today. We didn't only have Beijing, China, but we also had going to Italy during the winter semester. And you go to Italy and you learn about the Mediterranean diet. And as you can see here, you will be in the classroom, but you'll also be out sightseeing and having fun and enjoying the culture of the country that you're in. So, industry clubs. These are some of the organizations that the pharmacy school offers at UConn. We have industry club. We have clubs that fit any of your interests or skills or anything that you want to get involved in the pharmacy school. I mentioned the pharmacy fraternities. There we have 4 of them that you can be a part of, or you don't have to be. I'm a member of APHA. The ambassador programs you could be a member of. And the good thing about this is that you can be involved with these organizations when you're pre-pharmacy. Not all schools have that, but UConn really thinks that this helps their pre-pharmacy students because it gets them into the pharmacy school. It gets them talking to and working with pharmacy students already, so it can help them succeed in the future and know what they have to do to succeed. There's almost a club that fits every little niche or interest that every pharmacy student has. And UConn wants all their pharmacy students to be well-rounded individuals, and then they want us to join these clubs and not just only focus about studies. They want us to go outside of the classroom and participate in activities that we really enjoy, which we'll also see in future slides as well. So here's specialty tracks. I told you that I'm a part of the leaders track, where I learn to become a leader in the pharmacy industry or government, or just a leader in general. I take a lot of leadership courses, and I associate myself with a very strong group of leaders who are my preceptors and advisors. And they teach me certain characteristics and traits to learn and that are applicable to the pharmacy world, to being a leader. And it's not just pharmacy industry or government. It could be community pharmacy or hospital pharmacy, where you implement these characteristics. There's also urban service track, where learning to work as a part of a healthcare team and providing service to undeserved populations. This is giving a flu clinic in the inner city, in urban areas, or going to that migrant farm worker clinic and doing the brown bag take back. We also have the pediatric track. Children have different dosing and medication needs, so that's going and learning more about pediatrics, and so you can be a really successful pharmacist. And also pharmaceutical sciences track. This is exposure to pharmaceutical sciences and research. This is more of the research and development of medications and mostly being in the lab. All of these tracks are very beneficial if you have interests in any of these. But if you're not sure, or you don't really know where you want to be yet, or you don't want to be in a track, you don't have to be. It's not a requirement. Another part of the UConn School of Pharmacy curriculum is real-world experience. So we have pharmacy practice experience, where you are placed in a community pharmacy setting, a hospital pharmacy setting, as well as service learning. I went over service learning, that's going out in the community and providing your pharmacy knowledge to the community and helping improve health outcomes in general. Community pharmacy, at the end of your professional year 1, you'll be placed at a community pharmacy site where you will work 100 to 130 hours and you'll have a preceptor who will be a pharmacist that you will work under, and you will shadow them. You'll do the same thing for hospital pharmacy. You'll shadow a hospital pharmacist, but this will be at the end of your P2 year, professional year 2. So I'm about to go on my hospital pharmacy practice experience, and that will be in this summer. Then we also have professional experience. The entire last year of pharmacy school, so your 6th year, you have 9 one-month rotations in different pharmacy settings that you select based on your interest. This is one of the reasons why I chose UConn, is because they have 9 one-month rotations. That's a lot, and this is the year before you graduate, so this is I've been told that this is one big interview. So you'll have prospective employers that you'll be studying with for at least a month, and you want to show off that you're a right fit for that location, that workplace. And so this is a really great opportunity to do that. And not just for getting a job at that certain location, it helps you to try different things or do rotations in, say, critical care or pediatrics, and explore the pharmacy world to see if you can find that pharmacy niche or pharmacy branch that you really want to get into. So your academic path. So starting where you would start from your first year, you'll begin with 2 years in pre-pharmacy, now called a pre-professional program. Students then apply and transition into the professional program, which is 4 years. You graduate with a BS in pharmacy studies after 4 years in school. So that'll be 2 years of pre-professional program, then 2 years in the professional program. And then you graduate with a PharmD, a doctorate degree, in 6 years after your 4th professional program year is done. We also offer early assurance. We have a lot on our website, but to break it down a little bit, it's if you meet the GPA requirements in the pre-professional program, you'll be guaranteed an interview for the professional program, and you won't have to take the PCAT exam. If you have any more questions, please ask our ambassadors that are on this chat with us. So world-class campus. I've been talking about the School of Pharmacy, but UConn in general is a very good school and is one of the top universities not only in New England but in the country. Something that the School of Pharmacy offers if you choose to live here at UConn Storrs campus is the learning communities. So it's called the RX Pharmacy House. You'll be placed in the dormitory with other UConn School of Pharmacy pre-professional students. So this way you get to know your classmates and know who you're going to spend the next 6 years with. This is really, really helpful. One, for studying tips, doing homework. If you're struggling on a certain topic, you can ask your peers for help. They're very accessible. You'll be living a couple feet from them. Instead, because in your pre-professional year, you'll be with the general university for some of these classes, so you might not be sure who is in pre-pharmacy with you, so it might be harder to reach these contacts. And so living in the learning community is very highly recommended. But again, you do not have to live in this learning community. It's optional. Here's some other interests that students in our pharmacy program have. Intramural teams. Again, I keep reiterating it, but UConn School of Pharmacy wants everyone to be a well-rounded individual. And they know that everyone has other things that they like that aren't pharmacy. So here we have some pharmacy school students playing an intramural flag football team. They really enjoy sports, so they did that in their free time in the evening. Here's another pharmacy major. She enjoyed the music and the arts, so she decided to double major in the violin and in pharmacy. It's probably very tough, but she's able to do it, and violin's something she loves, so she's going to pursue it. Sky's the limit. This is another one of our pharmacy students. She's actually in my class, and she's on the UConn skydiving team. And you can be involved in any organization that UConn offers. They have many organizations. Another one of my friends is an a cappella group. There's many different options, and the School of Pharmacy doesn't hinder you from joining these organizations and taking these opportunities. They only promote this and encourage you to take on these. So I'm getting towards the end of this presentation. I really hope to see you this fall. I've been told to pass on the message that deposits are due on May 1st. Some financial tips for that are we offer New England regional tuition, which is discounted tuition, is available for students residing in Maine, New Hampshire, Vermont, and Massachusetts. We also have a Connecticut Promise free tuition for students with a household income of $50,000 or less. If you have any questions about tuition or anything about pharmacy, please email pharmacy@uconn.edu. You can also visit our website as well. We just redid that. Also, for more information, you can follow us on @UConn Pharmacy on Facebook, Twitter, Instagram, or YouTube. Follow us to see students in action, activities, events, and life as a PharmD to be. So I want to thank you all for listening to this presentation. I want to congratulate you all again for this very, very great accomplishment that you guys have achieved of getting into our pharmacy studies program. If you have any questions, this chat will go until 5. You can ask Bella, Aaron, Daniela, or Kat anything. Also, if you have any questions after this presentation and after the 5 p.m. deadline, you can Google UConn School of Pharmacy Ambassadors and click on our webpage, and you'll see the full list of all of us. I'll be on there as well as the other ambassadors, and it has a little bit about us, our picture, our bio, and also has our contact information. And don't hesitate to send us an email whenever. Okay? I want to thank you all for listening. I wish you and your families stay safe and healthy during these tough times, and I hope to see you next fall.